Hi, my name is Guillermo Torre, and I'm the president of TecSalud and vice president of research for Monterrey Tech. And it's really my pleasure to welcome all of you to this Health Sciences Group annual meeting of U21 that we're conducting on 2021. And clearly this year has been a year to remember. I don't think any of us would have predicted a few years ago what we would have lived 2020 or 2021. So I want to take a couple of moments to recap on some of the concepts and ideas that we've gone through Monterrey Tech, and in that context, to put a frame for our meeting, because I think we'll have some great opportunities that we need to discuss in the future. First, we are very happy to be one of the only universities to participate in U21 from Mexico. That at the same time presents us with a great opportunity and a responsibility. U21 has provided us the ability to interact with people from all over the world, but also with all the disciplines that are interested in providing a better health for the world. And I think we don't take that lightly, we take that as a very important responsibility. So in that context, you also need to know that Monterrey Tech is unique in the area of healthcare in Mexico. We have a hospital, we have a university that has med school, and we have a research institute. And I want to talk to you of how we confronted COVID, because I think from there, we'll take a couple of important points that I would like to leave you with as we enter the series of conferences that we'll have during this meeting. COVID not only put a challenge to Monterrey Tech, but it also clearly presented a huge problem for humanity. But in Mexico in particular, we were confronted with the inability to do a lot of testing at the beginning. We didn't have access to tests. We were not part of a community that had access to vaccines. So early during the pandemic, Monterrey Tech worked very closely with individuals and major foundations of society and with the government to create strategies that allow us to bring vaccines, to bring personal protective equipment to the healthcare workers, and also to create a lot of campaigns that were intended to educate healthcare workers in the community. And that is perhaps one of the very important lessons that I'd like to leave you for now, that it is only through interaction between the different sectors of the public and government and private and universities that we can provide great, incredible solutions. And COVID put us a challenge that we were able to respond to it, but only through interaction of the different communities. And the universities have a unique responsibility. We have the credibility of the government, we have credibility of industry. And we were, along with the National University of Mexico, we were the catalyst to create a movement across Mexico. So I'd like to leave you with that thought. And at least in Mexico, Monterrey Tech was a catalyst to provide interaction between the government and private industry to come up with important solutions to COVID, between creating strategies to obtain personal protection equipment, transportation with safe accommodations for the healthcare workers at the beginning, where we didn't understand what the pandemic was, to come up with major research initiatives to develop vaccines, testing, and equipment for personal protection. So the university has an important role in society, in problems, and the pandemic was a unique opportunity where that was highlighted. I also like to discuss with you our new vision of health. Hospitals have traditionally worked fixing problems. We're no different than a fire station. There is a problem and we fix it. And we've become very effective at doing that. But we at Monterrey Tech have taken an additional challenge. We don't want to see health as a problem that needs to be solved. We want to see health as a continuous that we need to work to maintain health. We don't want to resolve a problem. We want to provide the communities and the patients opportunities to improve their health so that they never need to come to a hospital for repair. So we see health as a continuum, proactive, not only a continuum where we solve a problem. We want to change how we think about health. And I'd like to give you also that challenge as we go through this meeting. Health has to change. We need to become active participants and providing wellness, prevention, so that we can live longer, not only a strategy where we repair. I think U21 is uniquely suited to provide the universities as a catalyst for better solutions for society, also a catalyst to transform healthcare from a repair shop to a continuum of health that will be focused on prevention, wellness, so that we can live longer. And I leave you with those two ideas because I think that the multiple nations that are represented in U21, as well as the multiple specialties of all healthcare workers and healthcare practitioners, have a unique challenge today. The future will be different. The future will require technology, will require multi-specialties. And we all want to live in an environment where we're not only repairing, but we're working to a better health. And we can achieve only that through multi-specialty attention. We will achieve that through a continuum of health and not through a strategy where we only repair the sick. COVID is a pandemic that will end soon, but then we'll have the challenge to take the opportunities, learn for a better, to transform a world that requires transformation with more equality across the world and with better solutions. Thank you for the opportunity that we have at Monterrey Tech to host you, and it is my honor to open this meeting for you. Thank you for your attention.